Today I want to talk to you about dental root canal treatment and its different stages in the procedure. Now look at this tooth. If you see this tooth in the mirror, maybe you'll say, I want to go and have the tooth pulled. But remember this important point, a decayed tooth is actually worth more than 100 implants. When a tooth decays and that decay eventually causes you pain and discomfort, the very first thing that needs to be done is to carefully remove the decayed part of the tooth. The decay may have already damaged the pulp chamber, and in such cases, we might have to remove the pulp or the nerve chamber of the tooth. Gradually and carefully, as the decayed parts are slowly removed and we reach the pulp chamber, we begin the root canal treatment. Now, look here, we've successfully managed to reach the pulp chamber of the tooth. In fact, a cavity has formed that has significantly affected the pulp chamber itself. As you can see, we carefully isolate the area around the affected tooth so that the bacteria inside the mouth do not enter either the oral cavity or the tooth cavity. After we remove the pulp from inside the tooth, as you can see here, in the same way, we also remove the nerve of the tooth. Look, this is actually the tooth nerve. There are different canals inside the tooth, each with its own nerve pathway. In different teeth, it means there might be a single canal, or like this tooth, there could be 3 or 4 canals. After the nerve is removed, we start cleaning the canals. Actually, the canals are located inside the roots of the tooth and they are carefully washed. The canals are thoroughly cleaned using rotary files, which are among the best tools available. These are root canal cleaners. The roots are then cleaned thoroughly. After the roots are cleaned and any remaining material is removed, the process continues. Bacteria and root inflammations are removed from inside the root and washed with a saline solution or disinfectant material and cleaned. We dry the inside of the canals with paper points. As you can see in the video after that, using a material called, we fill the inside of the canals with gutta percha and sealer, or in other words, we seal them so that no bacteria can enter the root canals. And using special dental tools, we carefully cut these cones off. Once again, we thoroughly clean the inside of the tooth cavity. It is now ready for us to fill the crown. As you can see, there is a remarkably clean, spotless, and completely bacteria-free space here. As you can see, we start filling the inside of the canals with tooth-colored materials and using a device called a light cure. This step is like this. First, we carefully apply a special material onto the tooth enamel, and after 10 seconds, it is rinsed off. And then the next step is to apply an adhesive material called bonding. We carefully apply the bonding process on the tooth and cure it. Using a device called a light cure with blue light, we carefully place our composite material inside the cavity and cure it again. We carefully apply these dental composites in multiple thin layers, which has the added benefit that the overall strength of the filling material gradually increases. As you can see, these types of fillings also need to take on the shape and form of the tooth. With a set of special tools, we shape the composite on the tooth in a specific way, and we select the composite color to match the tooth. We carefully create, and in this way, we are able to provide a truly beautiful and natural looking tooth that perfectly matches the color and shade of the neighboring teeth to our dear and valued patient. The anatomy, the form, and the overall shape are all taken into consideration. We create the surface anatomy of the tooth using these tools, and the reason is that the more the anatomy is beautiful, attractive, and based on dental principles, the better the food will be chewed. The final polishing is done. As you can see in the end, as you notice, a decayed tooth is gradually and completely transformed into a very, very beautiful and healthy tooth with high quality, and we have restored a decayed tooth and carefully delivered it to you. And this tooth can now serve you well for many years to come.